Good evening, countrymen and women. It is with great pleasure that I launch the commemoration of the International Epilepsy Day that falls on the second Monday of February each year. This year, we will commemorate this day tomorrow on Monday, 12th of February 2024, under the theme, My Epilepsy Journey. The theme calls for us to recognize the experiences of people living with epilepsy. We therefore need to give a listening ear to people with epilepsy, caregivers, health providers, and others to tell their story on epilepsy. Countrymen and women, as you may be aware, epilepsy is a disorder characterized by recurrent seizures. The condition also has psychological, social, and economic consequences. Around 50 million people worldwide have epilepsy. 7.6 people out of every 1,000 people will have epilepsy at some point in their life. Epilepsy disproportionately affects low and middle income countries. More than 80% of the deaths due to epilepsy are reported from low and middle income countries. The risk of premature death of people with epilepsy is estimated to be 3 times that of the general population. This risk may even be up to 7 times higher in some low resource settings. Countrymen and women, epilepsy affects not only people with the condition, but also their families and caregivers. This is through a range of significant personal, social, and ecological, economic, and policy issues that are directly or indirectly linked to the condition. It imposes direct costs on individuals and society due to the expense of healthcare and social services for comprehensive management of the condition. Epilepsy further creates indirect costs for disabling complications and premature mortality. These prevent the affected from reaching their full potential in school, employment, or in their family lives. Stigmatization of people with epilepsy, their families, and caregivers also imposes a great social cost on them. It denies them life opportunities and causes immense suffering. Countrymen and women, it is however reassuring to know that up to 70% of people with epilepsy could become seizure-free after appropriate diagnosis and anti-seizure medicines. Essentially, they could lead full and productive lives. In determining the measure necessary to reduce the global burden of epilepsy, consideration should also be given to the potential preventable causes of certain types of epilepsy. I say so because 25% of all epilepsy cases are caused by preventable events. These preventable causes include perinatal risk factors, traumatic brain injuries, stroke, and brain infections. Countrymen and women, the Ministry of Health is working towards achieving the objectives of the recently World Health Organization on adopted intersectoral global action plan on epilepsy and indeed other brain disorders. These objectives are set for a period of 10 years from 2022 to 2031, and they are based on the principles of the universal health coverage. The action plan emphasizes the need to prioritize improving primary health care and community services, which are closer to the people, thus leaving no one behind. All the measures set out can only be successful if the nation is well informed about the condition of epilepsy. Further, there is need to increase access to high quality health care and medicines, investing in research and social programs, and reducing stigma and discrimination attached to the condition. countrymen and women. To ensure that many people with epilepsy do receive the necessary treatment and control measures, we have embarked on the following: ensuring adequate supply of anti-epileptic medication in health institutions, having plans to establish epilepsy specialist clinics, acquisition of medical diagnostic equipment such as the CT scan and EEG equipment to enhance accurate diagnosis, construction of new hospitals and health posts closer to the communities, reducing the treatment gap through recruitment of more health workers, and partnering with the epilepsy support groups to increase advocacy and sensitization programs. Countrymen and women, this year's commemoration will be done through public awareness with information, education, and communication. Materials that have been printed, these will be distributed. Furthermore, let us all try to listen to the stories of our people with epilepsy through television and radio interviews. Let us all try to listen to the stories of health providers, family caregivers, community leaders, or educators about the epilepsy journey. Let us listen to what they will narrate and learn from their experience. Countrymen and women, the government of His Excellency, the President of the Republic of Zambia, Mr. Hakainde Hichilema, appreciates the continued cooperation and collaboration of the Epilepsy Association of Zambia. We further appreciate the Zambia League Against Epilepsy, the Pepco Glow Foundation, and all other epilepsy support groups and individual advocates. Your work to bring the public sensitization on epilepsy is commendable. The various activities during the Epilepsy Week, which you have organized, are a reflection of your belief in the suffering of the people with epilepsy. We firmly implore you, and let us all join hands in bringing into our discussion this rarely talked of condition of epilepsy. It is my singular honor and privilege to launch the International Epilepsy Day and Week of our awareness activities. I thank you and God bless you all.